Our next question comes from a man I met last fall. He's concerned that government policies are putting more drugs into his neighborhood.
When the sun goes down, you see, 3 or 4 heroin and crack dealers show up in front, and then the entire neighborhood comes to buy their drugs in the open air with police driving by all day.
That first-hand account from the co-owner of the football factory here at Bathurst and Richmond. How his neighbor to the north is the Queen West Health Community Center. Area businesses here say since that center was named as a potential safe injection site, they've seen a spike in drug dealers and users.
You're focusing so many at-risk people in a neighborhood, you're destined to have issues.
And Patrick is with us tonight. Patrick, your question for the leaders.
The province is funding safe injection sites and will be running legal marijuana stores in our neighborhoods. What will you do to keep those neighborhoods safe?
And Mr. Ford, you're up first.
Well, my friend, what I'm not going to do is I'm not going to have injection sites in neighborhoods. I strongly believe that we should have rehabilitation programs. I've announced $1.9 billion for mental health, addiction, and housing support. We will make sure we allocate the proper funds to have beds ready for people that have addictions. I've crisscrossed this province. I've talked to numerous people that family members have had addictions, and they're telling me they don't want an area that they can do more drugs. What they need is rehabilitation programs. We will fund rehabilitation centers with the $1.9 billion that we've allocated.
Ms. Lynn, you are now on the clock.
We have looked at evidence, and we are working right from preventing people from getting addicted in the first place through to saving lives. And what safe injection sites are about is about saving lives. And so we will continue to work with the professionals. You know, when I go to the United States, I've talked to 37 governors, and we talk about NAFTA, but the second subject we talk about is opioids. And we talk about a crisis that is, it's a global crisis, and we are going to continue to work and look at the evidence. I have had the opportunity to meet with frontline workers at the safe injection sites. That's where people find support. That's where they actually find a route to housing, to therapy. So we're going to continue to look at the evidence and support communities to help people who are suffering from these addictions.
Ms. Horvath, you are on the clock.
Thanks very much, and thank you for your question. And I know it's sometimes worrisome to see these kinds of things happening in your neighborhood, but I would have to say that I don't disagree with the idea that we do have to pay attention to what the experts say. And what the experts say is this is the best way to reduce harm for the individual and reduce harm in the neighborhoods. I can remember when my party office was on Richmond Street, and I can remember leaving after a late evening meeting, and there was a gentleman literally tied off, and we know what that means, with his vein up, and he was about to inject intravenous drugs in the doorway. As I opened the door, he got scared, I got scared. I'm sure he wasn't safe, and so the idea is let's save people's lives by giving them a safe place that's supervised, and then we can provide the treatment programs that they need.
And that is time. We will start our 3 minutes of open debate now.
If I can just quickly add 2 quick things. When I actually went and sat in the tent that is now, it's going to be a permanent site now. It's going to be in a building, not in a park. But I had the opportunity to talk with the frontline workers and some of the addicts. And one young man said to me, he said, you know, the reason I come here is that when I'm ready, and he said, I'm not ready yet, but when I'm ready to look for housing, to look for a counselor, I know that the people here will help me find that. So he's being kept alive so that he can actually get on track. There's nobody in our society who hasn't been touched by addiction in one way or another, family or friends. And so we need to deal with the evidence. The other thing is we're introducing cannabis. We're implementing the law that the federal government has passed, and we're doing that in a responsible way. We don't want cannabis sold in corner stores on every corner. I know that was what Doug Ford had put forward, but we want to make sure that there's a controlled rollout, because that's another culture shift that we are going through, and kids' safety is the top priority, and undercutting the black market is the second priority. So we have to do that.
It's not going to undercut the black market, and
I
think that's the most worrisome piece of this, is that the criminal element, if you will, that continues to be in the the drug business in our cities is not going to be impacted in any way by the Liberal plan. And so when New Democrats take office in a couple of weeks' time, we're going to have a hard look at what the Liberals have proposed and make sure that it does do what it needs to do, that it gets rid of the criminal element, that it ensures that the locations that are going to be used for the distribution or the sale of marijuana or cannabis are done in a responsible way in terms of community safety and proximity to things like schools, because at the end of the day, all we all want is a safe place for our families. We want a safe neighborhood. We want safe business
and that's
districts.
why we're working with the LCBO that has experience in dealing with controlled substances. That's why we're working with the LCBO, and 40 stores is the start, and we will roll this out in a responsible, safe way.
Well, there is one thing we're all in agreement, that we do want a safe neighborhood. We may take different approaches. One approach I won't do, Kathleen, I won't put it beside schools like you did. That's one thing. I'll make sure the kids are safe, and we'll have zero tolerance.
But you're going to have it in corner stores.
No, actually, I said LCBOs. If you listen to a lot of interviews that I've done, I said we're going to have it regulated in LCBOs. My friend Kathleen,
look, Doug,
what I'm not going to do is put it beside a school. You weren't on watch. It was beside a school under your watch.
It wasn't beside a school.
It was a few hundred yards away. So it's right beside schools. That's unacceptable.
So you know
I promise you one thing. I'll keep the kids safe, and I won't tolerate any impaired driving with anyone smoking marijuana. It'll have zero tolerance.
But you know that what addiction counselors and what mental health professionals will tell you is that having cannabis in the same stores as liquor, that's not a good idea. So that's the thing. You have to look at the evidence. You have to look at what the experts say. You can't just have a slogan that then becomes a policy. That's not how it works. You have to work with experts.
I will work closely with the community. See, my friends, this is a path we've never gone down before, any of us. So I'm going to work closely with the police. I'm going to consult with the communities and make sure they understand what this is, where we're going. Again, this is something that none of us have experienced.
Exactly.
The other thing to remember is that there are very few supports for people with mental health and addictions concerns. And so one of the things that we think we need to do differently in this province is focus on mental health and addictions. For 15 years, we've seen very, very little movement. There was an all-party committee that had all kinds of recommendations, very, very slow to make any difference whatsoever, because these issues continue to fall to the back burner. They're a headline for a couple of weeks, then all of a sudden people forget about it. We are going to bring forward an independent, separate ministry for mental health and addictions so that this issue doesn't keep falling off of the burner, so that we don't have 12,000 children waiting over a year on a waiting list to get some mental health supports.
But
can you
Andrea,
imagine that? If you're a child who's lost a parent, for example, who's lost a parent and is grieving and trying to get some support to get through probably one of the most difficult things they'll ever have to deal with as a child, you can't get those supports, and sometimes it takes well over a year to get that kind of help. No child should have to wait that long to get mental health services and supports.
And we need to start wrapping up now.
15 years later, that's where we are in the province of Ontario.
And that is time.
Well, City News devoted 2 months of special coverage to transit and commuting, and we heard many stories of frustration, including from one woman I spoke with who thought the Vaughan Line 1 extension was going to ease her commuting pain.
It's almost been every day that there's been delays, and it's added almost 15 to 20 minutes to my commute in the mornings.
Leah Benincasa says it used to take her an hour to get to work, driving to Wilson Station and taking the subway the rest of the way downtown. The new extension was supposed to cut that down to 45 minutes, with her commute starting at Vaughan Metropolitan Centre. But because of constant delays, she says it now takes her over an hour most days.
There's no space for you on this train. I do apologize, but stand clear of the doors.
Especially, promoting this new line, and it's going to save people time and travel and all that. If it's something that you're promoting and something that's new and upcoming, it should work.
And Leah joins us here now. Leah, what is your question for the leaders?
Thank you. What incentives will you give for me and others to take public transit?
Mr. Ford, you are first. Your time starts now.
Well, my whole political career, I've been fighting for rapid transit, not only for Toronto, but the GTA. And I'm here to announce that I'm going to build a regional transportation system that works for Toronto and the GTA. I'm announcing today that we're putting in $5 billion into new subways, relief lines, two-way go all the way to Niagara Falls. We're going to make sure that we build rapid transit. And I'm glad today to announce, again, we're putting $5 billion over and on top of whatever else is allocated to make sure we have proper transit, not only here in Toronto, that will extend right into the GTA.
So transit has to be convenient. It has to be easier than getting in your car in order for people to use it. And so we have been building transit. There is, there's $9 billion worth of transit that's being built right now just in Toronto. We're in the middle of a $190 billion investment in infrastructure around the province. So we have been building and we will continue to build. But it's interesting, Doug, you say you're going to build transit. When your government was in office last time, you filled in a hole on Eglinton Avenue, and we would have had an Eglinton subway on that road if you guys had not filled in the hole. So we've been building. We know that there's more to be done. We've got a long-term plan, and we're building regional transit and hooking it up with GO, and that's one of the incentives for you, is that it will be connected and there will be integrated fare across the region.
And that's your time, Ms. Wynne. Ms. Horvath, let's hear from you.
Well, Leah, I thank you for the question, and I think your question was missed a little bit in these comments because you're saying that there is a new build that you're able to take advantage of, but you're still not getting the service that's necessary for you to get to where you're going on time. And, people's lives are so busy. The last thing you need is to worry about whether you're going to have a 15-minute, 20-minute, half an hour wait for your transit ride. That's why New Democrats are going to reinstate something that the Conservatives got rid of and the Liberals have not reinstated, and that's operating funding so that we can make sure that there are more trains on the routes, on the tracks, more buses on the roads, more routes that you can have access to. $330 million is what we're going to be providing just for the City of Toronto, but around the province, transit systems will get operating.
That is time. You now have 3 minutes to debate. So, starting now.
And that sounds great, Andrea. The reality is that the reality is that there's gas tax.
And it's long overdue.
There's gas tax money that already is provided.
What happens, though, Kathleen? And you know this, right?
You know what?
Places like New York.
Can I just finish the sentence I just started?
What happens.
Which is that there is gas tax money that already goes to 99 municipalities around the province. And the problem with your plan is that the build doesn't continue. We have to continue to build transit around not just the GTHA, but around the province.
That's not true. We are actually going to be doing as much building. In fact, we're hoping to get it done faster than what you're doing. And we're not going to line the pockets of our friends in the financing model that you and Mr. Ford prefer. This is what the Auditor General has said, what the FAO has said. You've chosen the worst way to finance transit with the sell-off of Hydro One. Thank you very much. Something that everybody in this province is against. And the Financial Accountability Officer has said it is the worst way to fund transit infrastructure, any infrastructure. And the P3 model has wasted over $8 billion of our public money. These are the things you talk about,
Mr. Ford. What the P3 model has delivered
these are the waste things that you talk about, Mr. Ford. So I'd like to know whether you're going to be using the P3 model in your plan to build more transit.
What the AFP model has done is it has meant that we've actually gotten transit built on time, on budget, and we've avoided costs.
And you have feathered the nest of your friends, Kathleen, to the tune of $8 billion.
What you're proposing, Andrea, would take $7 billion, and that would be $7 billion that would not be available.
Okay, I'm going to let Mr. Ford.
Because you said you're going to buy back Hydro One.
I'm going to let Mr. Ford weigh in now.
Speak.
You know something? There's one thing we agree, probably many things, Andrea. Yes, Kathleen's been feathering the nest of a lot of people and lining their pockets. What we won't be doing is feathering anyone's nest. We're going to build transit. Again, we're going to build the first regional transportation system that connects Toronto and the GTA. We will put $5 billion into this program. We will invest to make sure we continue the loop along Scarborough and make sure we have rapid transit. And as for Eglinton, we sat down and negotiated with your government. They refused to bury Eglinton out in Scarborough. They truly believe, the Liberals, there should be a two-tier transit system. One transit system for certain parts of the city, underground. And then when it comes to Scarborough, the 630,000 people that only have 3 subway stations that are begging for transit, you ignored them. You want them to stand out in the cold, freezing cold. Matter of fact, you weren't premier at the time, your predecessor was, and they refused to bury Eglinton.
So you know perfectly well,
Doug,
you know perfectly well
freeze outside.
Okay, you know perfectly well that we worked with your brother's government, and you also know that you, when you were there, cut 33 bus routes in this province, in this city, and you cut night routes for people coming from Scarborough. You did. You cut them.
And that's time, Mr. Ford. I'm sorry, we are out of time. I'm going to send it over to Pam Seidel now with analysts' debate of what they've been hearing so far.
Thank you very much, Cynthia. We don't have a lot of time. We're going to do a quick summary of 3 of the issues that we've talked to. Murtaza Haider, did you hear anything you liked about solving our transit woes?
Well, if you hear the 3 leaders, you know exactly why the transit system is a mess here, because they are going it in a very wrong way. Liberals are spending $190 billion spending the transit we don't need and ignoring the transit we need. Doug has just again come up with another $5 billion things, and he thinks that subways will solve the problem. You cannot build solutions that are not required. Don't overbuild, and that would be the problem there. I think Andrea had a good suggestion of looking at buses and looking at the system and injecting it where it's needed.
Jody, any concerns about legalization of pot and community safety?
Yes, I was sad to see cannabis being condemned as a threat to public safety and a threat to children when we know that alcohol and opioids are devastating our people and our neighbors, and cannabis is actually proven to be a gateway out of addiction. And we should be looking at a free market of cannabis to provide more access through private retail, build jobs, give back money instead of having the government run it.
Desmond, did I hear that we're in black?
No.
Desmond, what did you hear about carding that you were either not impressed with or were impressed with?
The question was, what will you specifically do to eliminate the practice of carding since it's still going on? I didn't hear any specifics from anybody, but I heard a whopping lie from Premier Wynne. Kathleen Wynne said that they changed the law on carding. They did not. They created a regulation. Carding is still legal, and it's still happening.
Okay, thank you very much. This conversation continues on Facebook Live. Stay with us.